The director for the Crater Health District, Dr. Alton Hart, says he understands and shares the frustration with how the rollout has been going. And he says that Crater has been moving not as quickly as some of the surrounding jurisdictions because it's taken longer to get set up, saying they don't have as many resources as some of the other districts in the area. And that basically when the others in the area were moving to 1B, they were just really getting their 1A off of the ground. And they are trying to make improvements for their systems as they move into 1B, one of them being that they have added an online registration button on the Crater Health District website that people can register to get on that wait list for. At the same time, he says that they have added more operators and more telephones to the district's call center so that people who live in that district, which includes some rural counties who may not have internet access or aren't exactly tech savvy, can still call in. He says that that system has been overwhelmed since they've moved into 1B this week, and they have gotten thousands of calls. I've talked to elected officials in several areas within the district and saying that that's one of the big complaints that they have been getting, is that the call center has not been accessible for their constituents to get calls. So the director hoping that this will alleviate some of that frustration. Now talking meanwhile as well with the chair for the Sussex County Board of Supervisors, another concern of hers is about where people will have to go to get the vaccines, expressing concerns that they may have to leave their county or their city. First, hear from her, followed by the director for the health district, who says that is not their plan to do for the rollout for the seniors in 1B.
If you're 85 years old and your car, isn't the greatest in the world and you're faced with driving 75 or 100 miles round trip, that's just not an answer.
We have 7 health departments in our 8 localities, and we want to use all of our local venues as best as possible and we may have to use satellite sites in those localities.
And Dr. Hart says the speed at which they vaccinate is going to be somewhat predicated on the number of doses they get. And he says they are slated to get around 2% of Virginia's weekly shipments because of the size of their population. But he warns that it might take several weeks for someone who signs up to get a call saying there is an appointment. If you go to our website, WTVR.com, you can find the link to sign up online. If you want to call, that number is 804-862-8989. That's 862-8989.